So this is my first meaty video, and by meaty I mean like information. I know where I'm going to start, but there's so much information that I want to share, and I definitely don't want to just talk about chronic health issues. I want to I want to share stories, hopefully that people dealing with health issues can relate to. I want to talk about how the medical field works, but how it also doesn't work, especially when you're dealing with chronic health issues. I also want to eventually get into complementary treatments and how that helped me get well and continue to stay well. And so there's a lot of information and stories that I want to share. As I said in my introductory video, I've been writing a book on this subject for many years, but it's rather daunting for me to put all of this into words and to put it in in the format of a book. I'm hoping that doing videos is going to be, I don't want to say easier, but I find it easier to talk about, even though it would be easier if someone were here and we were actually talking instead of just me, talking to myself in this empty space. But anyway, hopefully that will change as some people kind of get involved if that happens. So I want to talk a little bit, first of all, about chronic illness specifically. And, these days that subject has even gotten broader. But let me go back to the origins. I remember when I first got ill, people talked about ME, myalgic encephalomyelitis. Unfortunately, I'm not sure exactly when, I think it was in the 70s, somebody, or a group of doctors, proposed that it should be called chronic fatigue syndrome. I'm going to link a video on my YouTube page to two videos, one giving the history of ME and chronic fatigue syndrome, which talks about that. I don't know why they did that. I think it was kind of an ego thing. I think it was because they wanted a name for themselves. And unfortunately, it really kind of watered down the seriousness of the problem. Chronic fatigue syndrome just became kind of a wishy-washy term that just meant, oh, people are tired, So it became easier for a lot of medical professionals to this day still to kind of look at it as a psychological issue. In fact, one of the main doctors that was involved in doing that was not even well, he was a medical doctor, but his specialty became psychiatry. And so that's an unfortunate history. But beyond ME, I also want to bring up multiple chemical sensitivities or chemical sensitivities, as Dr. William Rea called it, and I'm going to talk a little bit more about him at some point, and also environmental illness. I don't know what the best term is. We need to stick to something, and I would like to see CFS or chronic fatigue syndrome thrown out. I really like the term environmental illness. Again, Dr. Rea liked the term chemical sensitivity. And then you've got the ME Association, which has already been going on for a good number of years, I think from sometime in the 50s. So, but again, where it becomes more confusing is now you've got other terms that have been thrown around, like long haulers, POTS, Ehlers-Danlos, I can't even pronounce that term, EDS. For those of you who are watching, you're probably familiar with that term. Fibromyalgia, which is at least now being recognized. I know when I became ill, that was just another buzz term. And then there's other buzz terms that I'm going to mention and talk about in more detail as they apply to me and as because they're important in this discussion. And one specifically is leaky gut syndrome, but I'm not going to delve into that at this point. So regardless of what we call it, I think we need to stick to something because it's confusing. But I think part of the confusion, and I think a lot of, well, not patients as much, but a lot of doctors and researchers why they don't want to touch it is because this is a multi-system problem. And so it involves a multidisciplinary approach, right? Unlike, let's say you have a heart attack. Even though I could argue that that's also a multi-system problem, it isn't just your heart. It affects many other systems, and maybe many systems eventually led to you having a heart attack. This is more specific. People that are sick with ME, or I'm going to use the term ME, are affected on multiple levels with multiple systems. Your neurological system, your immune system, your musculoskeletal system, your digestive system. So when you approach a doctor or someone in the medical field, they just kind of look at you and throw their hands up. That would be a nice approach. Unfortunately, many people are told that, well, it must be all in their heads. Because I don't have the answers, or that's something I wasn't trained to acknowledge or work with. So again, a multi-system problem. And then I also said, and I think that's an important thing to talk about, is it involves oftentimes a multidisciplinary approach. Again, I'm going to get more into details with this in other videos, but I think of what I'm going to do just to kind of talk a little bit about some hopefully helpful ideas. Is I'm going to talk a little bit about William J. Rea. I believe his middle initial was J. Dr. Rea saved my life in 1992. No ifs, ands, or buts about it. I would have been dead by the end of that year, if even that long. So I've had that's 25 plus years now, because here on this beautiful planet, living, breathing, having a productive life, hopefully. I'm a counselor now. I'm also involved in the complementary health field, still doing some bodywork therapy with some clients, and I've been very fortunate. And not everybody has been who has gone through and dealt with chronic health issues. And part of the reason is simply not only because it's so difficult to find people to get treatment, but it's also extremely costly. Unless you have a lot of support and financial support, I don't know how you can make it through these problems. William Rea or Dr. Rea was a thoracic surgeon. He loved surgery. He loved to do surgeries. He had polio as a child. He wasn't a big man, and he walked with a pretty substantial limp, kind of like Dr. House from that show. I don't know what his actual character was called, or if that was, the name of the character, but I see clips of him every once in a while, and he kind of reminds me of Dr. Rea a little bit. Dr. Rea was, he's passed away a few years ago now, but he was a character. As I said, he was a rather small man of stature, but when he walked in the room, everybody stopped. He had a presence about him, and very intelligent, but also strong, and really believed in himself and what he was doing, which he had to be able to do what he did. I can't tell you how many times he was sued in his career by organizations like I don't want to throw out things that I don't know, but I know he was sued by medical organizations. like the Texas Allergy Association. But he was also sued by insurance companies because he didn't toe the line. He did his own approach. He had his own approach. But let me tell you how he got into it. So Dr. Rea, because of the surgeries he did, he was exposed to a lot of anesthetic, and I don't know, possibly other things that he was exposed to. So he became extremely chemically sensitive to the point that he couldn't work, had to live in a tent in his backyard. Eventually, through the help of other doctors that he came in contact with, he built himself a small home lined with porcelain, moved that out into the country in East Texas, and lived there while starting a clinic called the Environmental Health Center of Dallas. Eventually, he had a whole wing at a hospital here in Dallas called the Tri-City Hospital, where I became a patient in '92. Now, Dr. Rea's approach was, again, very different than a lot of doctors. And yes, he had an approach. He had a very substantial approach when patients came to see him. And he had patients from all over the world at one time, when insurance companies still would pay for treatments. That eventually got worse as time went on, and fewer insurance companies paid for the treatments. So you can imagine, if you weren't from the area, flying to Texas, having to pay for housing, food, accommodations for, relatives as well, and then also for treatments. But so what are some of the things that he did? Well, he oftentimes did blood work, specialized blood work, to look for chemicals in your system. I don't know if he also did urine analysis for that, but he may have as well. There are other tests for that as well, like hair samples. And then he also did, standard tests for thyroid and other issues. In terms of his treatment, though, one of the first things he did was tell people that they need to clean up their environment, like like now. And when I say clean up your environment, I mean rip out carpets, throw out new products, get rid of anything that may be off-gassing, plastics. If you're living in a new house, well, you may have to move. If you're living in a moldy house, you definitely have to move, or you have to do severe renovations. So clean up your environment. The second thing, and again, there's a financial factor there for sure. Second thing was change your diet and start a food rotation diet. For most people, that would mean that you would rotate not foods, but food groups every 4 days. So if you ate something out of a food group on day one, you couldn't eat that food again or anything from that food group until 1, 2, 3, 4, until the fourth day. Some people, because they were so sensitive, would have to extend their rotation diets. Why was that? Because food takes 4 days to get out of your system. Anything that you put into your body takes time for your body to process it. Not just your digestive system, but your liver, your kidneys, etc. Then he would suggest people to start doing dry heat sauna therapy. Why dry heat sauna therapy? And eventually he also started doing infrared sauna therapy in addition to dry heat sauna. Why? To help people sweat and detox. Oftentimes, if people were able to, they would take supplements before and after sauna therapy to assist them in detoxing, to assist their bodies in detoxing, but also to replenish certain minerals, vitamins, etc. And a lot of people who are sick with all of these issues are very deficient in a lot of these supplements. Magnesium is a big one, and I'm surprised. I just looked at the one of the ME associations at the supplements that they suggested, and magnesium wasn't even on the list. So that's surprising to me. But he was big into magnesium supplementation, vitamin C supplementation, and then certain amino acids also to help the detox process, like taurine, glutathione. I mean, there's others these days that people are familiar with, like NAC, N-acetylcysteine, and then also healthy fats. Healthy fats like flaxseed oil, fish oils, olive oil. He also, and in addition to the supplements, he also oftentimes, which again, if patients were able to and were able to tolerate it, he oftentimes would suggest intravenous therapy, where patients would get much higher doses of supplements, again, like magnesium. Oftentimes, they would get anywhere from 2 to 4 grams of magnesium per IV, grams, not milligrams. So that's 2,000 to 4,000 milligrams per IV. 5 to 15 grams, which is 5,000 to 15,000 milligrams of vitamin C. And then also, again, certain amino acids like taurine, and glutathione, sometimes also B vitamins and some of the minor minerals as well, the micro minerals. He also suggested in many cases people to do allergy testing. Now, this is where he unfortunately got into some trouble, especially with the traditional allergists, who have a very specific way of testing and believe that you can only test certain things. Don't believe in there being a problem, first of all, with chemicals in the environment, because many people believe they're safe, and don't believe you can test for a lot of the things that Dr. Rea would test for. Now, how did he test? Well, he did testing called neutralization provocation. Provocation neutralization is very different than regular allergy testing, where they test you and then they treat you on the wheel, which works for most people. But treating on the wheel means that you're actually provoking the immune system. Now, if you do that to a sensitive, extremely sensitive person, you're going to put them into a reactive state. And so, in provocation neutralization, let's just say you're testing for regional grass. And Dr. Rea had it all specified, like grasses, for instance. He had some grasses separated because they were so people could test them separately. But then he also would have regional grasses for different regions of the United States, and also primary grasses. So let's say you were testing for regional grass. You would start with probably not number one, because most people have some sensitivity to grass. Depending on your sensitivity, you might start with number 3 or number 5. And you would look for a wheal on the side of your arm. And if there was a wheal, depending on the size of it, then you would go to the next number or skip a number and go to the following number. Let's just say you started with a 3 and the wheel was quite big, so you'd go to a 5 or a 6. And you'd keep doing that until there was no wheel. So if you still wheeled on a 6, but you didn't wheel on a 7, and the 7 is the number of dilutions, each number is more diluted than the previous one. So you would treat on the 7. And for some people that were extremely sensitive, they would fractionate the shots. And then you would treat on the number that you were not sensitive to. Again, a very different way of testing than the regular allergy testing. And that helped a lot of people. So those are some of the ways, besides rest and clean air and water and lowering your stress level and all of those other things that I think pretty much everybody knows about. those are the kinds of treatments that Dr. Rea would do. Now, there were other situations depending on the patient, depending on what made them sick or what they were exposed to, that may be specific to them. Not to go too much into detail about that, but I had a friend who did all of Dr. Rea's treatments and got quite a bit better, but really didn't get considerably better until they had their amalgam fillings removed. And during that process, they noticed a huge improvement in their health. And they did it very carefully with a doctor, a dentist that understands chemical sensitivities. And they eventually got to the point where they could work and function again. So sometimes treatments are very specific to that individual. One thing I do want to say, and I feel like this is as good a place as any to say it, is sometimes the path to wellness. So make a note here. Sometimes the path to healing or to wellness is a different path than the one that got you sick, right? So maybe you were exposed to molds getting sick. Well, how you get well is going to be a different path. Your path to getting well isn't going to be eliminating molds. It may be doing other treatments to support your body in getting well, some of which, like I've already mentioned, or like the person that I knew who had their amalgam fillings removed. They didn't get sick from amalgam fillings. They got sick from mold exposure and from past chemical exposures as a child. But what eventually got them well was having the amalgam fillings removed. So sometimes it's a different path for different people. But there are some, I think, common and similar approaches that can help everyone. Again, the clean air, clean water, clean food, food rotation, eliminating allergenic foods, supplementation, and I'm not going to get into complementary treatments at this point, but there are other things you can do beyond that as well. I'm going to say one more thing about this area of health issues. It's much more common than a lot of people realize. Unfortunately, many of the people that struggle and are dealing with this on their own with family members. And so it's a very silent, quiet illness. And part of the reason why I believe the medical field doesn't, and let me say this, I don't think doctors, I think most people in the health field truly want to help. There's no doubt about it. But I think oftentimes they just don't know what to do. I think it would be best when they don't know what to do just to acknowledge it. But sometimes ego gets involved, and so I think I don't think I have to say anything more about that. But I think part of the reason the medical community doesn't want to give it the attention it needs is because it's a multi-system problem. And the medical model doesn't work that way. The medical model works great for acute problems, right? If there's an accident, you hurt yourself, if you need a kidney transplant, acute care, we've come a long way with acute care. But for chronic care, we're not doing very well. And maybe because we just don't have the ability to do a whole lot better. I don't know. But I think we need to start acknowledging that multi-system problems are a thing. And we need to start looking into why they're a thing and why the rates of a lot of these problems continue to go up, including problems that we've long recognized, like multiple sclerosis and other conditions. Why are they on the rise? So I will say this as a kind of an end to this video. Dr. Rea used to believe that chemicals are the problem, are the beginning of the problem to all of these issues. People in the ME field or a group or associations used to believe that viruses are the start of all of these problems. I don't know which one is correct, and maybe it's both. But again, we need to recognize that many things can lead to to your system, again, multiple systems breaking down. Dr. Rea used to have a barrel on a picture of a barrel on a poster board in some of his rooms. It was called the barrel effect. It's a very simple idea. And the idea is that once you add enough things to the barrel, it will start to overflow. And that's a very simple concept that I don't know why isn't acknowledged, again, by the medical field. And again, those things are chemicals, which, as you know, have continued to rise in our society. Viruses, bacteria, parasites, heavy metals, genetic issues, and then psychological, emotional issues. I don't want to get that involved in this because, again, a lot of people dealing with chronic health issues already have been told enough times that that it's all in their head. But I will say that I believe psychological and emotional issues are part of any illness. So let me just leave that there, and I will address that later on in another video. But I think the other reason why a lot of researchers, possibly, and those in the medical field don't want to touch these problems is this. Once we start talking about chemicals, then we start stepping on big toes. Because those in many fields, many different fields, oil and gas and the chemical industries, they don't want to hear that what they're doing is a problem and is affecting our health. Kind of like back when people used to believe that smoking cigarettes was actually good for you. We talk about things like, well, look, these chemicals, they're in such small amounts. They're not a problem. They can't really be a problem for anybody. Well, apparently they are, and have been for a long time. But for some reason, some people seem to be more sensitive, possibly because of genetic factors or other factors, where their bodies don't detox to the same extent or ability as others. And so it affects them in different ways. So there's a number of kind of hurdles or obstacles in the way here, but hopefully, people talking about it, me sharing my stories, can also be part of the process and help people to understand that that there is hope, because that's my point in doing these videos, is to connect with other people, to let people know that there are things that you can do to help yourself. There are professionals out there that will help, and also, again, just to share some stories from my experiences. So I will end this video at this point, and till next time, I will see you then. Okay, bye.